Product application for patient in supine position, lying on back. To determine proper size, begin by measuring the circumference of the patient's waist. Ensure the dial on each side of the orthosis is disengaged by pulling out on the dial. While in a standing position, place the orthosis so that the posterior panel is centered in the lower back area. Loosely secure side hook closure attachments. Next, place the patient in a supine position with their knees comfortably bent or flexed and their hips parallel to their shoulders. Adjust the side closure attachments, making sure they are symmetrical to one another and equal in distance from the center. At each side of the orthosis, the patient will find a dial. While in the supine position, the patient should push the dials in to engage, then turn knobs clockwise to tighten the laces. Turn both dials until a comfortable level of compression is achieved. This compression is totally adjustable and can be released or tightened using the dials to accommodate different activity levels. To remove the orthosis, pull out on both dials to release compression. Then remove the side hook closure attachment on one side.